Okay, hi everyone. I'm so sorry about the captioning issue. We tried like 5 different ways to get my presentation to work, and this is what it's going to be. I apologize. So thank you for being in the session this morning. It's really good to be here in person. My first presentation I ever gave at NACIS was in 2020, so it was virtual and pre-recorded, so it's a little weird to be in the room, but I'm going to do my best. As Alex so kindly introduced me, I'm Marielle Glynn. I work for CDC in the Travelers Health Branch as a spatial epidemiologist and cartographer. I work in the Division of Global Migration Health. Contrary to what the slide says, we literally just changed our division's name like 2 weeks ago, so I'll update that another time. The Travelers Health Branch, otherwise known as THB, creates travel health notices, or THNs, for outbreaks of diseases such as measles or Zika, or even for special events, mass gatherings, and natural disasters where there are broad public health concerns. We also assist with responses to health emergencies such as COVID-19, Ebola, polio, and more, especially as it concerns US-based travelers. So to start off, I want to explain just a little bit about what it means to be a cartographer in the public health space. When I started my job at CDC, I was hired to make maps for travelers' health publications and web pages. I was at CDC for about 4 months before the COVID-19 pandemic came on the scene, so that was a little bit of a whirlwind for someone just starting their career in public service and in public health. Even before then, I knew I might at some point be interested in getting an additional graduate degree in public health, but the pandemic very much solidified that desire for me. So I started a master's degree program at Johns Hopkins and got a degree in spatial analysis for public health. I wanted to do more than just make the maps. I wanted to have a more fundamental understanding of what my epidemiologist and clinically trained colleagues specialized in. I wanted to be able to work with the data and analyze it in a deeper context than what it takes to just manage the data for a cartographic product. Spatial epidemiology is the study of the geographic and spatial nature of disease and health issues, and it really encompasses everything I wanted for my career at CDC. So spatial epidemiology and cartography in public health looks like a lot of different things in my work. It means producing maps for anything from journal articles to print books, web pages to travel health notices, really anything that has a spatial component in our branch, even just questions about geopolitics and the portrayal of sensitive areas. I have an opportunity to work on that project or consult on that question. Sometimes that even means I've gotten to reach out to other cartographer and geospatial colleagues who work at the US Department of State and the National Geospatial Intelligence Agency, some of whom are at this conference. One of the primary projects I was hired for that I've gotten to work on over my time with the CDC is CDC Yellow Book, Health Information for International Travel. It is intended for use by travel health clinicians to inform their care and recommendations for their internationally traveling patients, primarily US-based patients traveling abroad. And while it is not technically an atlas, most people would consider it more of a clinical textbook. I like to think of it as a travel medicine atlas because I create a series of 46 maps for this book. So the Yellow Book was originally produced as a small yellow pamphlet as early as the mid-1960s, but in the early 2000s, it evolved into more of a full-color book produced on a 2-year cadence with the latest information about travel-associated illness and injury and recommendations for the prophylaxis, prevention, or treatment thereof. The exception to the biennial publication schedule was the 2-year gap during the height of the COVID pandemic, when many of the dozens of CDC and external authors were working overtime to respond to the pandemic or treat patients in a clinical setting. Over time, the focus of the book has changed a lot, and the maps in the Yellow Book have really reflected that. This chart displays our data from Yellow Books in the so-called modern era. This is that 2000 timeframe when the books started becoming a little larger, were printed in full color, and they started having maps that were made in-house as opposed to replicated from other sources. We have had over 40 maps in every Yellow Book since 2012, far more than the just 7 maps in the 2000 and 2002 editions of Yellow Book. In 2000 and 2002, the book only included malaria, yellow fever, and other disease-specific maps. These maps accompanied chapters specific to recommendations for precautions and prophylaxis for these diseases. The first reference maps were included in 2004. These were standard general reference maps, and it was largely up to the reader to view those maps and interpret the information from the accompanying chapter accordingly. For example, if a reference map of China was included and a separate chapter mentioned specific cities in China and health precautions that should be taken, the reader could then use the reference map to interpret the health recommendations on their own. However, over time, we shifted more from the reference map model to something we've referred to as popular itineraries maps. While most of the Yellow Book discusses various diseases and health risks of concern to international travelers, there's also a whole section dedicated to some of the most popular places that US-based travelers go, particularly those that have unique health risks associated with them. So rather than have just those general reference maps, we shifted to making maps of these popular itinerary locations and including specific cities, national parks, or tourist destinations that the authors of these popular itinerary sections wrote about, so that there would be more of a direct visual reference for the reader. In the recently published 2024 edition of Yellow Book, we had 46 maps in the print edition of the book. In the 2026 edition, which we've already started production on, we're hoping to include somewhere north of 75 maps. So significantly expanding our visual coverage of especially malaria and yellow fever maps. For Yellow Book 2024, myself and my colleagues Ryan Lash, who was the previous Traveler's Health and Yellow Book cartographer, and Jesse Blanton, an epidemiologist with a wealth of experience in spatial data and analysis, we all co-authored a chapter called Maps and Travel Medicine for the Yellow Book. It was positioned in the introduction section of the book, and we gave a brief history of the role of maps in the Yellow Book and included some early examples of what they looked like. This map, for example, was from Health Information for International Travel's 1974 edition, and it depicts potential or known areas of malaria transmission. This was merely a reproduction of a map that had been produced by the World Health Organization, and while giving an overall picture of malaria globally, it lacked sufficient detail to be easily used for informing travelers of potential risks at their destinations abroad. Our malaria maps now look a little more like this in the 2024 edition of the Yellow Book. These are malaria prevention recommendation maps for Brazil and Kenya as examples. You can see we use more detailed data, including elevation data in Kenya. We show subnational boundaries and far more extensive labeling to give clinicians a much more detailed concept of the true needs of their patients, what that might be in different areas within a specific country or even a specific state or province. Another early example of a Yellow Book map is this yellow fever map from the 1977 edition of Health Information for International Travel. This is a fantastic example of how disease risk and endemicity can be delineated. Sometimes it might be by lines of latitude, sometimes by country borders, sometimes by elevation or proximity to major bodies of water, etc. There is no one single way to delineate disease. Instead, it's entirely dependent on the availability and comprehensiveness of surveillance systems, the accuracy and frequency of disease reporting, and many other factors. So back to 2024, our yellow fever recommendation maps now look like this. We structure the maps based on where yellow fever vaccine is recommended, which has been evaluated based on vegetation indices, elevation, yellow fever surveillance and disease reports, all of which were considered in a global evaluation of yellow fever mapping by a WHO working group in 2010, with some modifications since based on factors like a yellow fever outbreak that happened in Brazil in 2017. So we've been through a good bit of the history of Yellow Book maps, but what does it take to make a Yellow Book map today? So this is a cartography conference. I think we all have a pretty good idea of what it takes to make a map, but I want to discuss specifically what it takes to make a public health map from a US government agency for a book that is, again, what I like to think of as an atlas of travel medicine. There are many questions that I think about when I'm planning the creation of maps for a new edition of Yellow Book, and many of them have to do with data. I work with clinicians and epidemiologists extensively throughout the Yellow Book production process, as I am not a subject matter expert in any of the individual diseases that I am making a map about. Likewise, these colleagues of mine tend to not be experts in making maps. So it involves a lot of communication about what I need from them in terms of spatial data, what format the data are currently in, and what kind of data management might be necessary to make it work in GIS. The classic questions cartographers ask at the beginning of making a map. Data sources are also incredibly important for Yellow Book and at CDC in general. We can only work with data from official sources like the World Health Organization or country ministries of health. When the data were collected or created is also very important. These are maps and information being used to give people important health recommendations. We want to make sure that we are using the most recent information available. And again, as a US government publication, we need to make geopolitical considerations. Are the data broken down in a way that is representative of the US government's geopolitical views? Is there anything about how the data will be visualized that is sensitive and needs special considerations? And once a Yellow Book map has been drafted, I have even more questions to ask. All that data we were talking about, how does it look in the map now? Are the data still accurate, or has any information become newly available? Are the data portrayed correctly? Or maybe we found during the process that less information was available than we expected, or some data were missing. How will that change what our goal for the final map is and what it will communicate? Is a map still the best option for the information available? The next consideration is then style. I ask if the map looks how the subject matter expert expected it to. In a general sense, some stylistic elements are actually just determined by myself and the book's publisher early on and can't really be changed. And I ask if there's anything that they would like to see included that's currently missing. Finally, and perhaps most importantly, we discuss the messaging. Will the map convey the appropriate message to the audience? Is there anything misleading or confusing that would diminish the effectiveness of this map as a visual health communication tool? And again, touching on these maps being of locations around the world from a government organization, is there anything about the map or the message that might be sensitive or controversial, where we'll need to make sure we do extra reviews to ensure that our message is clear and sensitive? So we take all those considerations about data and visual messaging and communication. We do our best to look at the maps as the clinician might, as the general public might. We think a lot about how to phrase the wording in the legend so that it's direct and concise and medically accurate. And we make sure the place names and labels on the maps are accurate and match the text. And aside from the importance of being medically and geopolitically accurate in a US government medical text, I do what any good cartographer does. I do a lot of tweaking with the colors and the labels until everything feels just right. We go through a ton of iterations until we have something that is intuitive, clear, and effective and ready for a CDC publication. And we end up with something like this. This map specifically is titled Malaria Prevention in Brazil. It details where one should take malaria chemoprophylaxis versus only avoiding mosquitoes versus areas in which there is no known risk of malaria transmission. While this is all information that is written out in text format in the Yellow Book, these maps take complex, dense information and put it all into a single, straightforward visual tool that healthcare providers can use as a visual reference when providing care and advice for their patients. And at the end of the day, we have two Yellow Book products, the traditional printed Yellow Book and the digital Yellow Book. Our managing editor and health communication specialist, Suraj Arshanapalli, headed up a massive effort over the past 2 years to create a beautiful new set of web pages for the digital Yellow Book to make a much more seamless, accessible, and visually appealing reference for clinicians who may not be carrying the printed version of the book with them and need a quick digital reference available in the clinical or field setting. I need to acknowledge some of the colleagues of mine who I work with on this project. Dr. Jeff Nemhauser, who was the editor-in-chief of Yellow Book 2024 and is actually now retired, was part of the committee that hired me at CDC. He's become a personal mentor and friend, and despite not being formally trained in cartography, he has one of the deepest appreciations for maps that I've ever seen and was a spectacular map editor for me throughout that process. In addition, Dr. Eric Halsey and Suraj Arshanapalli, who are my current colleagues on the Yellow Book 2026 edition, and finally Drs. Ryan Lash and Jesse Blanton, who I collaborated with on the 2024 edition. So thank you very much for being here for this talk today. If you would like to visit the digital CDC Yellow Book, you can use that QR code at the top of the screen. There's a whole section called Yellow Book Maps that you can scroll through to see all 46 of them. And that brings me to the end of my talk today. Thank you so much.
Thank you, Ellie. We have time for one question. Question? There we go.
They are not currently, but we are looking at creating more of an interactive profile for maps in the future that could be available in the digital Yellow Book, in which case, whenever there's an interactive map available, we tend to try to make the data available for that as well. So it might be something that's more readily available in the future. Yeah.
All right. Thank you very much, Ellie.
Thank you.
All right. Nathan.